Hi, my name is Naima Lawson, and today I will be administrating an enema. The date is October 26th, and the time is 10:57. Before I'm going to my patient's room, I'm going to state that I've already filled up my enema bag with 500 milliliters of water, and the tube of the enema bag did not touch the sink. Next, I'm going to go into my patient's room, do the privacy drape. Then I'm going to introduce myself to my patient. Hi, my name is Naima Lawson. I'm your student nurse today. I'm going to ask them to state their name and date of birth. Okay, correct. Next, I'm going to ask them if they've ever had an enema before. He states he has. And then I'm going to ask him what was his last bowel movement. If he can remember, I want him to state the color, the shape, and the odor of the bowel movement. Okay, great. I'm done assessing my patient. Next, I'm going to go over here and I'm going to do my hand hygiene. And I'm going to don my clean gloves. Then I'm going to get all of my supplies. I brought a bath blanket just to make sure my patient has privacy. Let me place that right over patient's area. He's already in the left lateral position. Next, I'm going to put the waterproof pad underneath my patient's left side. And at this point, I'm also going to assess if my patient has any feces around his rectal area. If so, I would take the bed bath wipes and I would clean that before the enema. Next, I'm going to take my paper towel and I'm going to take the lubricant and put it on my paper towel. Like so. Then I'm going to come over to my enema bag. I'm going to take my lid off and I'm going to well lubricate the tip of the enema. Okay, great. Now I'm going to take my bag off the IV pole. And the bed is also raised up to the level that I need. Raise up just a little bit more. And I'm going to hold the enema bag so that way I kind of have control when I unhook the clamp. I'm going to put it back on here just until I start my enema. Okay. And then I'm going to tell my patient 1, 2, 3, and I'm going to insert it towards the umbilical. Insert the enema tube about 2 to 3 inches. And then I'm going to take my enema bag and hold it down by my waist to kind of control so that there's not a whole bunch of water going straight into my patient at one time. And then I'm going to unclamp it and I'm going to make sure that the enema bag is up, putting all of the 500 milliliters into my patient or until my patient is resistant and can't hold any more water. And I'm going to also ask my patient if he is okay during his procedure. And once all the water's out, I'm going to clamp back the enema tube. At this point, I'm going to tell my patient 1, 2, 3. I'm going to gently pull out the tube. Okay, so now that I've disposed of my enema bag, I'm going to come back to my patient. If there's any lubricant, I would clean it. I would also tell my patient to try to hold the enema bag for at least 5 to 15 minutes, or as long as they can. I would have the call light right here, ready for my patient. I'm going to dispose of my gloves. And I'm going to wash my hands. After that, I'm going to make sure that my patient knows where the commode is, if that's what he chooses to do. And then my patient should be set. And I'm also going to document what I did. Okay, thank you.